So, ladies and gentlemen, my name is Abi Mwachi, the National Chairman of the KMPDU. Esteemed members and anyone else who is following us online, I stand before you today to deliver a State of the Union address from my office as a chairperson, highlighting the remarkable achievements and progress that you have made as a union over the past 2 years. It is my honor and privilege to share with you the milestones that you have reached over the last 2 years that you've been in office. First and foremost, I would like to commend and celebrate the successes that you've had in Laikipia. Through our collective efforts and unwavering determination, we fought tirelessly to ensure that the rights and well-being of our fellow doctors in Laikipia were restored. The victory not only brought relief to our colleagues, but also demonstrated the power of unity and solidarity within our union. In addition, promotions have been achieved across a dozen of counties, including significant progress made especially in Nandi County. Those deserve special acknowledgement. The recognition of our members' hard work and dedication is a testament to the positive impact we have on the healthcare system. These promotions not only motivate our doctors, but also inspire them to continue providing exemplary service to the nation. Recognizing the importance of addressing personal issues that affect our members, we established a wellness committee as an ad hoc committee of the KMPDU. This committee plays a vital role in safeguarding the mental, physical, and emotional well-being of our medical professionals. By focusing on our personal needs, we can better serve our patients and contribute to a healthier society. Furthermore, our efforts in the legal arena have yielded great successes. We've emerged victorious in a total of 16 cases, each representing an important milestone in defending the rights and interests of our fellow doctors. Through strategic litigation and diligent advocacy, we have cemented our position as a force to be reckoned with, ensuring justice and fairness prevail. Another significant achievement lies in our staunch resistance against 2 acts that threaten to compromise our pay slips. We recognize the potential detrimental effects that these 2 acts could have on our financial security and fought passionately to protect our incomes. Our collective voice and resolute determination made it clear that as a union, we will not allow any encroachment of our rights and of pay slips. Moreover, we've made considerable progress in organizing and strengthening our structure. We've institutionalized the frequency of our meetings, both at the branch and national levels, to ensure effective communication, coordination, and decision-making process. This is work in progress and reflects our commitment to fostering unity and efficiency within our union. As we reflect on these achievements, let us also acknowledge that there's still much to be done. We must continue to negotiate for better working conditions, improve remuneration, and enhanced career prospects for all medical professions in Kenya. The challenges ahead may be great, but so is our determination to overcome them. Together, we remain fired up and ready to go as a team. Let us build upon our accomplishments, leveraging on the strength of our unity as KMPDU and the power of our collective voice. As we move forward, let us be guided by the unwavering principles of equity, fairness, compassion for both our patients and ourselves. Thank you. May we continue to serve with excellence and dedication for the betterment of our healthcare system in Kenya. For the more comprehensive State of the Union address, which will focus on the nitty-gritties, it is my sole honor and privilege to invite the Secretary General of the Union, Dr. Daji, to give a more detailed with the focus of the nitty-gritties. Thank you.
Thank you. Yeah, thank you so much, Dr. Abidal Mwachi. To the Chairman of KMPDU, Dr. Abidal Mwachi, the members of the National Executive Council, the members of the National Advisory Council, to elder members present this afternoon. I take it as an honor to deliberate and to deliver this particular State of the Union address for the year 2023. which actually covers what we have tried to undertake, the achievements, the challenges, the collaborations, and the partnerships that we have had since our last Special Delegate Conference in Nakuru on 25th and 26th of November 2022 to date. Ideally, we were to have a Special Delegate Conference today, but National Executive Council in their meeting of 25th November 2023 made a decision for us to have this particular meeting in a physical setup so that members can engage and so that all these things that we're going to spell out here, you can see a framework to have them achieved. But before I start, I would like to say that this year has not been very good to all of us. This year, we have a record that we've lost 12 doctors amongst us. And even this week and next week, we have doctors that are being laid to rest. This year, we have lost about 5 of the dependents of our doctors, some as the spouse and some as their children. And in all of them, we have paid benevolent funds, but it has been a very sad situation for the organization. In the same year, we have seen many of our colleagues from different counties losing their loved ones, mostly their parents or their siblings. And we have seen in numbers, because it almost happens in every group of WhatsApp, where the contributions, when we look at the estimates, we see up to about 100 to 115. So I will ask us to take just 1 minute, 1 or 15 seconds, in remembrance of our colleagues who have lost their lives during this period, or who have been bereaved over this time. Thank you so much, ladies and gentlemen. If I go back to the reports or the resolution of the Special Delegate Conference that was conducted on 25th of November 2022, it provided an overview of the things that we need to undertake as a union in the year that we are now coming to an end. And some of the things in highlights was the collective bargaining agreement and SLC, which was really making it difficult to have negotiations. And we resolved last year that by the end of this year, we should have all the doctors across the country having comprehensive medical cover. We resolved that by the end of this particular year, we should have the issue of collective bargaining agreements of 2017-2021 resolved. And in that Special Delegate Conference, members said that we will even proceed to an industrial action if this was not done. We also put it as an agenda, and a very critical one, that we were to have doctors employed and a framework of continuous engagement put in place. Because we have seen over the years that there's even a hazard deployment of interns. And once they've deployed and they've been trained and they've finished their internship, we have seen a policy where there is a train and dump. They're left with no any future, with no plans. And we know very well that this happens amid shortages within the counties, within the hospitals. So it was a running agenda and a resolution of the Special Delegate Conference of last year. We also made a resolution to have a training framework for postgraduate doctors. That it's not right after the collective bargaining agreement was signed. It's not right with the existing career progression manuals that any doctor who has worked as per the required time to be denied opportunity to go for the postgraduate studies. And therefore, this was a running call that every county and in every branch and every doctor who qualifies to go for this particular training had to be given opportunity. We also embarked on a very rigorous process to bridge the gap, because we noted in our last engagement that with unemployment of doctors, the private facilities, the private hospitals have put up a place or mechanisms to now exploit doctors than has ever been seen before, whereby they do not want to have any correct terms of engagement. There are no pensions, there are no covers for them. And in any case, they tend to casualize our colleagues. And therefore, as a running call and as a resolution of last year, we made it clear that we have to unionize doctors, both in the public sector, in the private sector, and the faith-based institutions. That is recruitment without borders. That was the resolution of last year. We also made a resolution to have a review of the constitution of the union so that it be more cohesive and more members involved. We call it a ground-up approach than that which only have a top-bottom criteria. So I would like to report that on those issues that we discussed last year, we've had rigorous engagements with both the national government, the county government, and we've all taken into consideration even the legal strategies to ensure that some of the demands of the things that we have put in place are actually implemented. And I will start with the issue of collective bargaining agreements of 2021-2025. After the special delegate conference, because we wanted our issues to be a priority to the government, many felt the government was still new in office, and therefore we gave a notice of intention to strike, and we gave the government 30 days to look into the issues that we were demanding, the things that we had resolved as part of our SDC of last year. That engagement resulted into deliberations that we've had with the ministry and with the counties from that time. And I will start with the first thing, which was the matter of internships. With these demands, we saw all the interns that at that point had not been posted were all posted. We also came into agreement with the government that interns ought to be posted 30 days after halting, just as it is in our collective bargaining agreement. We still believe that is the stand that has to be implemented. And also we are looking at mechanisms to ensure that the university align themselves with the ministry so that the matter of budget do not come as an issue of hindering posting of the interns. And I must say that after that particular approach, we saw this year that interns were being posted in January, they were getting posted in May, and some again posted in July. And then we believe that even those who recently just halted, the 750 of them, need to be posted the first week of January, because it becomes inhumane or inhumane to graduate and to wait for 2-3 years before you're posted. On the issue of the collective bargaining agreements of 2021-2025, SRC had made it very clear that it was impossible for us to negotiate any monetary values on these collective bargaining agreements. And therefore, when we gave our proposals to the government and to all the 47 counties, we gave into consideration the consumer price index of the country, the inflation, the GDP, and all these matters. But then the ministry took its time, the Council of Governors took time, until 1st of July, that we started getting response on the negotiation of the new CBA. The government gave us a counter offer on our proposals in the month of October, which we've written back to them because some of the proposals or the articles or the gains that we had were being deleted from that CBA, from the new CBA 2021-2025. And we have agreed to have scheduled meetings to resolve the matter of the new CBA between January and March 2024. It is upon the government to actually fast track this process, because for us, the agreed salary increment in the CBA will have to be paid from the time the CBA 2017-2021 lapsed. And therefore, I believe that will not be a loss on us, but it will be on the part of the government and any other employers that we will be negotiating with.
because we know very clearly that if we would have negotiated before July or before June, then the SRC letters that have been repudiating any monetary gains will have affected us. But now we are on a right progress on the same. On this issue of CBA, I will also talk on the KNH CBA. We came into agreement with KNH last week that the CBA that they want us to sign without monetary gain could not be signed. And as such, we both wrote to SRC, who now have recommended that we can have the monetary gain in the KNH CBA. And we gave them 14 days, which lapsed on 11th of December. And we have seen a positive letter that SRC has written for the first time, saying that agreement that KMPDU will have with KNH will then hold the day. You must also note the aspect of the CBA between KMPDU and MTRH, where SRC completely repudiated the leave allowance that was agreed between KMPDU and MTRH. On this matter, we have taken MTRH to court, but their response was actually supporting our petition in court. So I believe that is going to be registered, will be registered, because we're going to win that in court. And ideally, the leave allowance that the doctors in MTRH are earning will not be changed. On the issue of CBA, again, I must say that we had given proposals to Nairobi Hospital, despite the fact that they refused to give to have a recognition agreement with us. We gave them a proposal, and we are in the process to force them actually to negotiate and have the doctors in Nairobi hospitals protected. And because we have a court order that actually enforces this, we are in the process to really go for the CEO and the management and even the board to ensure that the doctors in Nairobi hospitals are also protected. Finalizing on the issue of CBA, we go to KUTRH, where we have a recognition agreement. We had already given our proposal also of the CBA, and we were to finalize this in the month of November. We were seeing a situation where there was a particular mechanisms the hospital was using. They're trying to bring up the issue of doctors have to send emails to the management before they're allowed to be in the union or before they're allowed to subscribe to the union. So we have gone strongly against this in KUTRH, and we believe that our action, which then is to protect the jobs of those working in KUTRH, so that they do not have those 3 months, 5 months contracts. I believe that's the directions of the new CBAs, and we want all these new CBAs not to be those that are negotiated without monetary gain, because we are all cognizant of the financial situation of this country. There's no any employer who will give us finances or who will give us any salary increments if we do not force them to do it. I know all of us remember how much the union has given us in the previous engagements in 2011, in 2013, in 2016. It will not be any different in 2021, 2025. It will have to force us to take serious actions for the government and for any other employers to actually part with finances. Because we know very well that government's role is just to take taxes. We know very well that employers' role are just to get benefits. But our role as unions is to negotiate for our wages and our salaries. And I must promise you, if we go together in unity, 2024 will be our year to ensure that we have actual salary change in our pay slips. And that's from the basis of the National Executive Council postponing the SDC for this month, because we want to use the month of April. We want to use that time to actually force government to give us the change, the salary increment that we need. It has to be part of their budget. It has to be part of their plan. And if need be, our annual delegate conference of 2024 may be the basis to either launch an industrial action or any actions that will make sure that whatever suffering, whatever the inflations, whatever the economic situations that are coming forth based on this period are actually sorted by our action. I must go straight to the issues that we also discussed last year to have Health Service Commission. We know the frustrations that doctors have had across the country. We know the haphazard promotions that happen in every place, some based on tribalism, some as from due to favoritism, some have to pay bribes to actually be promoted. Some have to essentially, the County Public Service Board and other employers will demand crazy things for people to get even these jobs. So we have been advocating for Health Service Commission. And I must give you a practical example why we have always needed this. The case example is what's happening currently in the Nairobi County, where we have 115 doctors that were employed with the Public Service Commission. When the new government came into office, they now want to award the political demagogues or political friends or political colleagues. And what they do is that they re-advertise these positions with an aim to ensure that those who are employed are the people that they need. In the same process, the boards demand for bribes. While we know that those facilities exist, we know that the doctors that are working in this particular facility are qualified. None of them has gone through any disciplinary cases. So as a union, we say that there's nothing so simple for us to take action. So we actually took Nairobi County to court and stopped the employment of the 8 doctors that they're saying, because they have shortlisted the same doctors who are employed by Public Service Commission. And our demand in court is to have these doctors employed on permanent and pensionable terms, because that's what the county advertised. That's what the PSC had recommended 6 months after these doctors were employed. And in that particular matter, we have the employment process that was ongoing in Nairobi County suspended until 9th of February, when we believe that case will be finalized, with an aim that the contracts of these doctors that's ending in March will find them the time that they are converted to PNP. And I believe that is happening in every county. We have seen the situation in Vihiga, where the county has blatantly refused to do any promotions. We have seen the same situation in Kilifi. We have seen and experienced the same in Embu. We are seeing strike notices of the same issues in Nakuru. It's a matter that revolves and that every doctor can relate with, including even in Kajiado. So this has made us come out very strongly demanding for Health Service Commission. We have tried to campaign for it. We join hands with civil societies to bring a change to the same. But we know, sometimes before we get that, we may land somewhere. And we saw the government action the KHRAC, the Kenya Health Advisory Council, which then as individuals from the County Public Service Board, from the Council of Governors, from the County Public Service Board, from the ministry, and we are trying to use this particular body as a stopgap measure to align our issues. We know that this body does not have a teeth. It may just be a body that just gets these informations and does not action them. But there's an existing mistrust between the Ministry of Health and between the county governments that has actually resulted in a lot of suffering of the doctors. And therefore, we have been seeing that based on this issue that we are demanding, or that are revolving in the counties, where we have been demanding for Health Service Commission, we have landed to use this KHRAC to resolve some of them. And this brings us to the point that we had, the demand for employment. So to have doctors employed, we believe this could be done very well with Health Service Commission. But now, what do we do now? What actions have we taken against that now? We led a demonstration and took petitions to the Parliament, to the Ministry of Health, and to the Council of Governors. This then resulted into a conversation regarding the plan of the government, particularly on the aspect of human resource. We have had engagements on 18th, we had engagement on 11th and 12th of October regarding employment of doctors post our demonstration. And this came up with what we call Kericho Declaration. To us, the benefit that we see on that Kericho Declaration, if it is implemented, is the employment of doctors. Why are we saying this? Because it gave two aspects or two promises that are very key and critical to us. One of them is that post-internship, the doctors will be retained in the ministry for at least 3 more years. What that means is that every doctor who graduates, they will have to stay, be on payroll for 3 more years while they are taking the same preparation to be relevant in the local markets and national markets. For us, that will mean that there will be a creation of jobs for about 3,000 doctors with that particular agreement, if it is implemented. That's one. Number two, we have seen all the 47 counties claiming that they have reached the budget ceiling for employment. And that's why, despite the ravaging shortages that they're having, they have been unable to employ. And we agreed in this particular engagement that the budget of counties has to be managed, to be handled such that that ceiling is configured, particularly by the PFM Act. And with that, it will allow for employment of doctors. This is something that we have also anchored in our new CBA, to at least have each and every county actually commit to the number of doctors they employ annually. And so therefore, I believe that we have that if this particular Kericho Declaration is implemented, that will be of great help. But despite that, we also have the issue of health cover, which we had committed to have sorted out. At the time that we're talking about this, the only county which had never seen any cover from 2017 was Bomet. But I believe that's now resolved. We also had other counties across the country who are benefiting from National Hospital Insurance Fund. But the government, or those county governments, actually changed from that NHIF to some private insurance, which we're finding to be of less value compared to what doctors were enjoying in those covers. And some of them we took to courts, like Kiambu County. In Nairobi County, we negotiated with that insurance to be at the same level with NHIF. But we have other counties, like Narok or these other counties, who took actually NHIF. We are seeing that a part of our declaration was to have comprehensive cover for all doctors by the end of this year. And again, we know we have Social Health Insurance Act, that by the fact that it commenced its operation, the one component that has come out on it is the removal of enhanced cover. And one thing they say to the drafter of the same act, they say that we need to go and negotiate with our employers so that they can get us the cover that we need. I must tell you, and you have seen our actions on this thing of Social Health Insurance Act or enhanced benefits. It's something that we don't negotiate about. It's something that has to be there. Our only biggest concern is that why will the employer, who is the government through the Ministry of Health, tell us that we need to go look for our employers to negotiate with, to get the private insurance without putting a clear framework that will ensure that every doctor who is benefiting on this enhanced cover that they're now removing is covered. I must tell you, doctors, we all know the frustrations that we can go through. We have all seen the situations where we have to do contributions. We have all seen the situations where we'll have to sell all our properties to get care. We may compromise on many things based on the situations or economic situations that the country may say. We may compromise on many things that we may be awaiting for action about. But I must tell you that the issue of our enhanced cover for all doctors across the country, regardless of the employers, must be a priority. It's something that we will not negotiate with, and it's something that we have to fight for. When you see us fighting in court and stopping the Social Health Insurance Act, that becomes the most primary thing. Because with that act, almost each doctor will be contributing about 200,000. But again, you are being told to go look for another private insurance. That is the highest level of immorality that anybody can actually give us. We have to come out and call injustice for what it is and demand that whatever profits or profiteers want, whatever actions that they do for each and every doctor, your comprehensive cover should not go below what you have in NHIF. It should not go below what is provided for in SRC recommendations. I must come on to tell you that in the coming year, we may have more challenges, just like we had this year. One big elephant for our salaries, an enemy for workers in this country, is Salaries and Remuneration Commission. I must tell you that SRC, in this year, they had planned to remove non-practice allowance. They will plan to remove everything or every allowance because they don't see any justification for us earning them. You will see that we went to court against SRC, and SRC made it out strongly, and they're trying to justify why we don't need to earn those allowances. We are happy that it's out of collaboration with the institution like Public Service Commission, with all the LSK and all other societies. We managed to win that case strongly. But despite that, SRC has appealed, which we know we will win. But I must tell you that we have to stay vigilant on these bodies because we are seeing a situation whereby the target of SRC, the target of the government is to see how we can reduce our packages. The only umbrella or the only body that will ensure these things doesn't happen, not by begging, but by action, is the union. So let's stay steadfast on this aspect. Let's know that whenever we are fighting, we're not just fighting for those who need to be employed. We're also not just fighting for those who already been employed, but we are fighting so that in every essence, our livelihood can be protected. We had talked last year about the union communication, the communication app. I must report that the app is currently running, and I must confirm from you that you've been receiving SMSs and emails. We're just in the process of now making this app available in Android and in iPhone or iOS for every doctor across the country. This is just to ease in our communication and to make it easier that the ground up approach that we are trying to implement becomes possible. We want a situation whereby there's nothing or there's no problem of any doctor across the country becomes too difficult for the union to handle. A situation by every doctor, whether in Turkana, whether in Mombasa, whether in Lamu, you know that when you are facing any aggressors or any oppressors, it's not you as an individual doctor, but it's a burden that is being borne by all the doctors across the country. And the only way to have this is to have members empowered and to have members able to communicate and reach all the leaders in adequate time. I must also say and reiterate something that Dr. Mwachi had said earlier, that is the Members Welfare Committee. In the last year, in the resolutions, we said we will form Wellness Committee. I must say this committee is now well and running. The committee is handling a lot of cases across the country where we've had many of the doctors who may be addicted to particular substances, who may be having frustrations. As a union, we're out to handle these issues because the welfare is not limited only to salaries. The welfare is also part of the holistic being of an individual as a doctor. And when we're able to have safe space to talk with each other, it's much easier and much possible to protect ourselves. On the aspect of the review of the Constitution, I must say that we all do not need to see the divisive politics that we had in 2021. It has taken us 2 years while having litigations on leadership in the courts. It was not the right thing to be done, but then it happened. It will be an injustice for us as leaders of KMPDU to have the same scenario repeated in the future. We need to have an organization that members have say all through, that leaders are not looking only for themselves, but for the organization. And therefore, we have started the process of constitutional review as had been adopted in the last year's SDC. The legal committee will forward this to all the members across the country so that we can give our inputs in the right time. We can have a conversation about it in our town halls, and so that we can actually have this constitution that has been reviewed to be part of our discussion in the ADC. It is just after that ADC that we can know the next direction on it. But we must completely participate on it with an aspect to build this organization beyond any individual leader. On the issue of membership engagements, we have tried to have Kamkunjis, have discussions, and have meetings with doctors across the country. But I must say we have to do more. It's only through engagements, only through membership training and empowerment that we are going to build this union much stronger. Yesterday, 2 days ago, we had a meeting with doctors in Kajiado. And there were very many horrific stories that maybe would have been prevented if we had had a mechanisms to have this issue reaching our offices in a early time. And we resolved to have, beyond just the county liaisons, hospital reps across every hospital in the country, so that when these doctors are being frustrated, when the doctors are being indignified, these issues can be resolved immediately. It is an injustice to face disciplinary action and not have a discussion with the union or not being represented in the union. We have to stop this. We have seen situations across the country. We saw it in Embu. We have seen it in Kiambu. We also saw it in Kajiado, where employers just wake up and stop your salaries. It is unprocedural. It contravenes the collective bargaining agreement. And we want doctors to come out so that this thing can be stopped strongly. That there's no any employer who has a right to stop your salary. There are procedures and processes that have to be undertaken. And this can only be stopped if every leader, if every member, if all the union is empowered to understand it. On the partnerships and collaborations, I must say that this is one of the strategic pillars of the union. And we have strongly collaborated with different local organizations. We have collaborations with Amnesty International. We have collaborations with People's Health Movements. We have collaborations with TISA. We have collaboration with different civil societies. And also we have collaborations with the local health unions and public sector unions and Central Organization of Trade Union. These collaborations are majorly to help us to protect our interests. We are members of the community and members of the society. We have to demand for these things, and we have to really demand them strongly, and we must have the public who we treat as doctors be and understand that it's a right to actually demand for better healthcare. And therefore, even in this litigation that we have started against Social Health Insurance Act, we've gone for it as a team. We have an application as KMPDU. We have a filed petition by Kenya National Human Rights Commission. We have a petition which is jointly by around 5 bodies. And we have also individuals that we are working with that had to file this particular matter with an essence for one thing, that there should be a quality access of healthcare to all. And with that happening, there must be an investment in healthcare. And we must have doctors who are well-skilled, well-motivated, and well-supported to offer these services. So we are part of the society. And that's one thing that we've come out very strongly in our partnerships. We also have global partnerships. We work very closely with ILO. We are work very closely with People's Health Movement internationally. We also work very, very closely with WHO and also with Public Service International. And I must tell you that you've seen a lot of engagements that we have and a lot of movements that we've done. And some of them is courtesy of me being elected as the president for all health sector unions in Africa. And one thing that I must say, that in the World WHO African Charter of 2023, it's clear that there's a shortage of more than 6 million health workers across Africa. And therefore, we must align ourselves to these policies, actually to demand for our government to implement them, so that the unemployment, the unnecessary migrations that are in existence can actually be stopped, with the aim to dignify the health workers and doctors across the country. On the aspect of legal strategy, I must say that we have been using different strategies to ensure that we meet demands for members. You've seen a lot of industrial actions across the country. Some of these issues, some of these problems that our members face actually need local solutions. And that's why when necessary, like now, you are seeing industrial actions in Kilifi, you are seeing Kajiado, you saw one recently in Nandi, we have one in Vihiga, we have another one in upcoming in Nakuru. The aim of the industrial actions actually to force the counties to do to doctors what ought to be done, and to have these negotiations, the CBAs that want to be implemented. So a lot of times when the branch leaders or when the local leaders call for these meetings, it's very important to attend, because some of the issues need actual local solution. I must also say that there are those that need boardroom meetings. We've had meetings for the whole of this year, and I will give you details of it in part of the basic side that are owed to us. There are also those things that need legal strategy. And I must say that this year we have the record number of cases that we filed. In this year, we filed about 31 cases across the country. And so far, we won 16 of them, and the others are still pending in court. One of the very critical cases that we won, but we've not closed even today, is the one regarding the university fees. We know very well that the university had hiked the fees, and based on the judgment that we got, the university did not actually comply. So we had to force them. But even after they complied and we have the concepts, we are still monitoring and to ensure that there's no doctor, there's no person actually who is doing his postgraduate who's affected by this. And there's no way they increases the fees without engagement of the stakeholders, particularly KMPDU, as had been agreed. And therefore this matter is still running, and I think it's coming for mention in the month of March 2023. I must also bring very strongly the issue of Kirinyaga. I know many have forgotten that this matter still exists. We have got a favorable judgment over this matter, but the county government has been so increasingly, I would say, not ready to actually have these doctors back. And in the span of 1 year, the county has filed 13 cases against the reabsorption of those doctors. But we have won all those cases. Most of them have been dismissed. It's only one that gave them stay on the content proceedings that we have initiated against the governor. But this matter is coming up in January 15th, which we believe at that time we'll have to resolve the issue of Kirinyaga. I must also say that there's no any doctor that is too small to be protected. As individual leaders, we may forget the problems that any member may have, but a union can never forget. And therefore, the union can never leave any of these issues that have been started halfway. They will have to be resolved. I must also say on the legal strategy that we had a case between KMPDU and Kitui that actually resulted into the 19 doctors being absorbed back. This is despite the county having employed others. But in that prospect, there's some funds that these doctors had not received. And now we are trying to resolve that matter because there's no doctor who need to lose any money that they are rightfully theirs that have been budgeted for. So we have started actions and see to what mechanism can this matter be reopened so that these doctors benefit. Now, having had a discussion on those issues of legal, as I said, 31 cases, they'll form part of the whole report that will be shared out to all the members. And you will see that there's no any of these institutions that has not been touched. And I must really say about the call allowance for doctors, particularly those in the universities. I know we have managed to resolve the one for Ministry of Health. What is pending in the Ministry of Health is just the arrears for the call allowance. We managed to resolve the call allowance for the doctors in JQuat. What is just pending is actually ensuring that the right amount is being paid because they paid less. But we have a problem with KU where we had won, we went to court together with those particular doctors who work in the staff doctors, the hospitals. But then the university has not paid them that money, and instead the university appealed. So it's more than 5 years, but these doctors have not benefited. So I think it's 2 weeks ago that we started having discussions with Kenyatta University to see how we can resolve this particular issue out of court. This also goes to Moi University, where arrears were paid to the lecturers, doctor lecturers, but the staff or the doctors within the hospitals were not paid. We've tried to have discussions with the university, but then they have not paid this. We also went to court over the same, and we're actually in the process of contempt. So I believe we are going to enforce that to ensure that all those doctors who work in the university staff, that's particularly Moi University, are also paid. So I believe there's none of the sectors that we have in the union that is left aside. And this also go hand in hand with the collective bargaining agreement that we are currently negotiating with the ministry and the Council of Governors with the counties. We want, and we are ensuring that there's no doctor that is left out. On the issue of the private sector, as I said, we have collaboration with international bodies. We have Public Service International that has employed for us an organizer who is out to recruit and bring on board all the doctors in the private sector. We want to stop these manners of frustrations and exploitation that is ongoing in the private hospitals across the country. And the only way that can be done is by dignifying these doctors. So we have a one-year project that runs between November 2023 to November 2024. And we started well with Medihill Hospital. We have Nairobi Hospital and all other private hospitals. We want to have every doctor unionized, that within that period, as we work for the CBA, for the public sector, we also have CBA in the individual hospitals, because every worker has a right to enhance medical cover. Every worker has a right for pension. Every worker has a right to enjoy all that which is enshrined in the Constitution and the Employment Act. I think at this time, I want to go into the issue of basic salary 2017-2021. We all know that this was to form a basis of our strike in January this year. We've also said it's allowed strongly that it was to be part of our strike in December this year. And I must say I've received several calls from different doctors, including my good friend, Dr. Steve Onyango, who asked me, when are we getting this money paid? But at one point I asked him that, how much are you owed? And I may ask each of you as doctors, as an individual, based on the CBA 2017-2021, do you know how much you are owed? So that resulted into formation of a multi-agency team that was then to get down to the data of the data of individual doctors and the amount that they are owed. We've had several meetings from January 2023 to actually last week. We've had a lot of retreats. We've had meetings in Nairobi, some in Naivasha, on different places. But I must say that in our last engagement, we were able to put figure to the name of every doctor. It was clear, though, that the doctors working at the Ministry of Health or at the headquarters, this particular basic salary component had been implemented. And there were not many, about only 400. But the 4,400 doctors across the 47 counties are owed money. From our primary report, per month from 2017, July, to 2021, September, the doctors are owed 1.2 billion. But you may not say that the exercise that we took is so accurate that can know everyone's into details. And that's why we asked to have this State of the Union address so that we can tell you what we are going to do from this point. We are going to ask each and every doctor across the country to verify the amounts, because there are those that are owed 500,000, there are those that are owed 300,000, there are those that are owed 150, there are those that are owed 600,000. So we want each and every doctor to verify this data from the hospital level, from the county level, from the branch, so that by the time we are having a meeting on 18th of this month, we have all the doctors have actually analyzed and know that that's the money they're owed. That you know, as Dr. Steve Onyango or as Dr. Elena, you are owed this amount of money and whatever has been put in these figures are right. After that, we have to agree on the date of payment because now we know the amount. And these monies, we believe, should be paid before our next meeting, that is the annual delegate conference that is scheduled for the month of April. And therefore, we need a very strong collaboration. We need each doctor to actually take this as a priority, especially those who are in the counties, that they go through the data that they'll be sent for. We'll have different engagements, and particularly we'll send them by emails. We won't send the entire data, we'll send for everyone their data. So that is where we are with this issue of basic salary. And now we believe, now we know the 1.2 billion need to be paid. And it need not to be paid in the future, it need to be paid now in the nearest time possible. And sometimes in this engagement, I must say that the government has said that they signed the CBA under duress. It is very, very most likely that we may have to give them some duress to pay the same monies. And you must be prepared because there's no employer, as I said, who always pays money without being forced. And I also must say, this is a court order. It was a court order for them to pay this money. So once we have finalized this on 18th, it will also be filed in court as a consent for them to give us the dates of the payments of this money. Having said that, I must bring us back to the issue that is happening now, particularly on the Finance Act, which we also filed a case together as public sector unions, and the issue of Social Health Insurance Act. I've seen a lot of uproar from doctors, the public, and everybody across the country. But I must tell you, the uproar in WhatsApp groups or in Facebook or in social media do not bring the change we may need. If you want sanctity, dignity, and value for our payslips, we must come out for actions when we are called for. We must actually demand that our payslips be respected. So despite our outrage and our demands on the changes in the Social Health Insurance Act, we do not agree that we should be deducted so much money without the government or without the employers increasing our salaries. In our engagement with the NHIF and COTU and KMPDU between July to October this year, we had an agreement that this money will be deducted 2.75% from the basic salary. Later in the engagement, the minister confirmed that it will be capped at 5,000. But as it is now with the public participation, it is at 2.75% of the gross. And you know what it means. So I must tell you that we must oppose this. Public participation in this country has turned into public manipulation, because you will go to all those forums, you will present your documents the way we did for enhanced schemes, the way we've done for all the finance bills, but then it remains like that. We must come out strongly to demand demand sanctity, demand respect for our payslips, and we must be out to bargain. So time and again, as this goes, we will call you for action, doctors, but because you know that if this money is implemented the way they did for the Finance Act, probably, and I've seen most people have already had budgets, it will actually throw you into disarray. So this is one of the first things we're going to demand, and we're going to have action for it. We're going to call you out on different ways to push it back. The next thing is on the housing levy. As you know, we contribute in housing levy 1.5%, but there's no any future hope to access those houses. That's why we are saying we don't need it. And we know very well that it was also found in the court to be unconstitutional. Our role now is to demand our money. That also will not come easily. We must come out strongly to demand for that. To close by, I want to say that there's nothing more important for a union than the word union. There's nothing more important for KMPDU than unity of all the doctors across the country. There's nothing more strong than us speaking in one voice. We may have individual problems internally, but we must know that any aggressor from outside must find us united and strongly together so that we can push back those issues. I must tell you that with our ground up approach and strategy that we're going to use, no doctor will be left behind. Thank you.